We at Hopkins have noticed that the prevalence of hidradenitis suppurativa has been increasing over the past 20 years or so. And we think that there is something in our environment, maybe in Baltimore, maybe in the US, that might be causing this increase in HS. So we did a previous study in which we were able to show that there's an association between processed foods and hidradenitis suppurativa. And then diving deeper into those things, we were able to show that the concentration of some chemicals called endocrine-disrupting chemicals, which is a hot topic right now, are high in those processed foods. In another study that we did, we were able to show through a survey that patients who have HS have a higher consumption of processed and ultra-processed foods and use plastics more than healthy controls. So, for example, they microwave foods and plastics more than healthy controls. So, based on all of this data, we think that there's something in processed foods and in plastics that is leaching into food. And those are the chemicals that we think are causing this, endocrine disrupting chemicals that are ingested in our foods. They accumulate in our body. So those chemicals like fat, and there's fat in our skin. So we think they like to sit in this fat. And then when we sweat, they are excreted in the sweat and they will be causing HS. So this is something that we're trying to currently investigate because we think it's really important because it's going to change the way how we perceive HS, the way how we treat HS. So in order to be able to prove our hypothesis, we were able to show in the lab that those chemicals can cause enzyme dysregulations that can cause HS, but we also need to prove that these chemicals are present in high concentrations in patients who have HS. So we need to be collecting sweat from those patients and analyzing the sweat of patients who have HS and patients who don't have HS and compare the concentration of those chemicals in people's sweat. And the way that we want to do this is through a technique called LCMS, and that's what the AARS grant is all about. So this is not a standardized technique. People have only used this once or twice in the past. So in order to be able to conduct our analysis, we need to develop the technique, to validate the technique, and to standardize it before conducting our analysis. So we are very grateful for the AARS for funding our research and specifically this project. I think if our results show that there are strong links between those chemicals and HS, this could be implicated in our practice in the future. So it could be something that we could use in our clinical care to try to screen patients that could have some implications in their treatments in the future. For example, if we have an HS patient and we conducted this analysis, we were able to show that we have high concentrations of those chemicals in this patient's sweat. We would be able to first of all, provide targeted therapies maybe in the future. And we'd also be able to focus more on lifestyle changes in addition to conventional treatments that are available for HS. So eventually, we'd be providing more of a holistic approach to our HS patients, talking about their diet, talking about their lifestyle, behavioral factors, and giving them, of course, usual treatments and biologics. So we previously did some research. We noticed in clinics that our patients used to tell us that they think that their HS flares up when they eat out, for example, when they have a burger at McDonald's, for example, and then they feel like their HS is more quiet when they opt for a Mediterranean diet. So that prompted our initial investigation looking into the impact of diet on HS. And so we were able to collect data on a national and international level. So we looked at the different states in the US. We also looked at different countries, and it wasn't easy because we are lacking a lot of data on HS. But based on our research, we were able also to collect some data on dietary habits in the US. And we were able to show that there is indeed a strong correlation between the consumption of processed foods like burgers, pizza, sausages, for example, and HS, whether being in the US or even internationally. And we were able to also show that minimally processed foods such as fruits, vegetables, and grains could have a protective effect on HS. Now, this only says that it's a correlation study. So it's not a causality study. We don't know for sure if this is causing HS, but we do know that there are links between this and HS. And this is what we're trying to get to. We want to get to a point where we can say, well, this is causing HS. what do we do now? And so I think for the double exposure that we were talking about, so indeed, these patients are exposed to endocrine disrupting chemicals, and we're all exposed to endocrine disrupting chemicals in a way or so. So, for example, the production of plastics has increased from 2 million tons from the 1950s to 450 million tons today. And I think that people are starting to become more and more aware of the impact of plastics and microplastics and nanoplastics, whether being on our health in general, like fertility, for example, or cardiovascular health, or even in dermatology, like we are currently doing right now. I think this is more of a public health issue, but what I think is important here is to show these links, these correlations, which could lead to potential collaborations with policymakers and public health experts that could have some changes and some implications on the system in general, not just in dermatology. So I think it's something that's very important that we're doing. The way I was aware of the AARS grant was in the AARS symposium at the SID. So I was invited to give a talk about our project, which was great. And I'm very thankful again for the AARS for giving us the opportunity to talk about it, because we still haven't published anything yet back then. So in May, we talked about our project in Texas, and I remember talking about available grants for early researchers. And it's not easy to get funding and grant opportunities, especially when you're getting started into research. So the AARS told us about that grant. I was like, let's apply. Why not? I'm going to take my chances. So I put in the application. We applied to this grant. And a month ago or so, I received this email saying that we got the grant. And I will never forget that day, honestly. I was very happy to get that email. I'm very grateful and thankful for the work that the AARS is doing. As I said, I think our work is really important. And I think funding is always a limitation in research. So having this grant, which is actually my personal first grant, is a huge boost for me. It's a huge motivation for me, and I think we're going to be able to achieve amazing things. Whether we find that there is an actual association or not, I think this grant will help us get one step closer to the truth and help those HS patients that need our help.